So racism is really what I feel like is a key public health issue here. And it's a contributing factor that has domino effects when you look at Black maternal health and disparities that exist there. Even after you adjust for education, income differences, and health, with Black women, there's just continuing to exceed the experience of the social determinants of health compared to their white peers. Some of the factors I see is that Black women generally have faced years of structural inequities within our healthcare systems. Doctors spoke to it before as far as there's being chronic illnesses that may exist, but in addition to that, Black women may also have issues engaging with their primary care physicians or prenatal care due to either implicit biases that could exist or just a broken dynamic and relationship between healthcare professional and patients, and the trust not existing between those two. There's also obviously the historical context and just the impact that Black women have had in society as far as their reproductive health and the damage that's been done in that area, as far as being trusting in that medical professionals have their best interests in mind. So all of this takes place, again, with a backdrop of the healthcare and the insurance industry that doesn't necessarily work for women, and especially pregnant women of color. These have really adverse quality of care impacts that really prevent and limit the access to care and exacerbate the disparities that we see existing for mothers to get the care that they need prenatally, postnatally, and really taking care of themselves. So, as the professional healthcare aspect may be a key impact, I think it then, again, has another impact where women will have that because of the hurdles it'll take to take care of themselves, they put it on the back burner to then pour into their families, taking care of their loved ones, their children, family and friends. And that's another opportunity where it is almost encouraged that as mother, as a hub of the household, they are almost last in line as far as taking care of themselves, especially when it comes to things like maternal care. So there's a complex web that feeds into why we continue to see Black mothers being severely impacted and the difficulties it takes to extricate them out of putting themselves in the position where they are not getting the help they need.